I'm Dr. Kevin Dukes at Tulsa Bone & Joint. I'm one of the shoulder surgeons here. Myself or one of my partners may have discussed with you shoulder replacement surgery. It's one of the most gratifying surgeries we get to do for someone who has an arthritic shoulder. As with any surgery, there's risks and benefits that you have to consider. Fortunately, the risks are rare, but they can be significant. One of the risks that we consider is infection. We want to do everything we can to minimize that risk preoperatively. We want to make sure that we have no preoperative known infections. If there is a concern, please discuss this with your doctor. The other risk considered neurologic injury, a very infrequent and unusual injury, but can be serious. We also are worried about fractures after surgery or dislocations. You may need another surgery, and there may be loss of range of motion. What we frequently do is replace the damaged ball with a new ball, and we replace the socket with a new socket. After your shoulder replacement surgery, we're going to give you some very specific guidelines on the management of post-operative care. One of the very important factors is we want to be very careful with your rotation. What we refer to as external rotation is a concern for us. As we replace your shoulder, we have to detach one of the tendons to replace your shoulder. And it's very important that that repair be maintained after the surgery. So it's very important that we limit what's called your external rotation. This is considered the neutral position. This is internal rotation. We want to limit your external rotation after the surgery. This places the shoulder replacement at risk. People that need shoulder replacement, we frequently replace the glenoid, which is the socket of the ball and socket joint. This smooth surface becomes very rough, and we'll replace it with a piece of plastic. The ball gets replaced with a metal ball, usually made of cobalt chrome, and those two surfaces together are very smooth and provide with a painless range of motion. After your shoulder replacement, we'll have very specific protocols. Much of this will be done by yourself at home. Some of it will be followed under the supervision of a physical therapist, but there will be very specific guidelines, and we'll have established goals that hopefully you'll meet. Lastly, there's always risk with anesthesia, so it's very important to discuss this with your primary care doctor and discuss this with your surgeon if there's any concerns.